Hi, I'm Mike Brach. This is my dog Junior. This is the Tribe Wellness Gym and Physical Therapy Clinic, and this is a foam roller. We've had other videos where we look at how you can use the foam roller on your quads, on your hamstrings, on your IT band, but it's also a great tool for getting some gentle movement in the spine. So a lot of people find if they sit at a desk all day typing, or even just over time as we age, the shoulders start to round, the head comes forward, the trunk kind of tips forward. And as a result of this posture, a lot of bad things can happen to your balance and all kinds of other issues. But what this foam roller can help out with is trying to alleviate some of the stiffness that occurs back here from that posture. So you can think of it as a way that won't cure the problem, but can help you get some relief of some of those stiffness and pain symptoms. The other thing I like about it is on the spine, if you're doing it right, it gives just a little bit of gentle movement at each segment of the spine. And that's so nice for trying to keep your discs in your spine well hydrated and lubricated, and trying to alleviate some of that stiffness and rigidity that builds up over time. So you can use a foam roller like this, or they come in white, they come with all kinds of different bells and whistles. I think cheaper is better. You can get them at Amazon, at Target, at Walmart, a bunch of different places. You can use them on most types of flooring as long as the foam roller isn't going to slip around, and as long as you are not going to slip around on the floor. I'm using it on this yoga mat just so you can see and differentiate the roller from the black flooring that we've got here. If we're using it on the back, what I like to do is set the foam roller down, work my way down to the floor, and it's best on your mid-back and upper back. It doesn't do as much down here, but as long as it doesn't hurt, you're welcome to try, right? What I like to do is I like to start out with this thing where I'm rolling up and down, and it's perfectly perpendicular to my body. So it's parallel to like the collarbones or towards a line across my shoulders, but my motion is up and down this way. So I like to just start easing my way back onto it. And you don't quite want to be doing one of these numbers. So if you can keep your head a little bit active or supported, that's helpful. Or what a lot of people like to do with the foam roller is start out giving yourself a hug. And this is nice because what we're going to do is we're going to get a little bit of rounding in the spine. And if we start out in that mid-back, sometimes you hear a few pops and cracks as you gently work your way up and down the foam roller. All of that is okay as long as that popping and cracking is not accompanied by pain. I'm also trying to make sure I don't roll the dog. So I'm going to scoot down a little bit here. And what some people like to do, or what most people like to do, is when they're hugging themselves, just start working that roller up, really trying to accentuate the muscles that run along the side of the spine. And when you get up near the shoulder blades, usually the higher you go, the more you start to work on some of that tightness or tension that a lot of people feel in their upper trap muscles, which tend to be chronically tight. Upper trap muscles really cause a lot of trouble for people. With any foam rolling, you'll find too, if there are tight areas, it's going to be a little achy. You're going to have some muscle soreness as you go through it, and you might even feel like you really had a hard workout the next day. But that's all okay as long as that soreness doesn't last for multiple days. If it lasts longer than a couple days, be sure to talk to a healthcare provider so you can get some help. Pretty uncommon for that to happen, though, if you're doing this in the way we're talking about. What you might do too is if one side is giving you a little bit more trouble, you might just kind of bias that side by tilting your body over a little bit on the foam roller to get, so you can see right now I'm on the back of my right shoulder and I'm just really trying to hug this arm across so I can get some of those muscles around the shoulder blades. The foam roller doesn't do a heck of a lot for your bones, so if you're rolling on a bony area, it's not going to do much for that, but it really helps with muscle tissue. And now I'm just kind of working out the other side, which is also disturbingly tight for some reason. And it's pretty common to kind of wince a little bit, but you'll notice right when you stop, that pain should go away, and you should feel a whole lot more mobility. So try it out if you feel like you're stiff. And afterwards, just see how much better you feel moving. Hopefully, this video and use of a foam roller can help you not to cure any problems, but to feel like you're getting rid of some stiffness, getting rid of some soreness, and moving a little better.